getting into kind of like the reference planes of motion and axes of rotation and things like that, what we really need to really try to do is that imagine you. What I'm going to ask you to do is really difficult. I'm going to ask you to imagine a two-dimensional surface that's running through the body inside of the three-dimensional surface, or inside of the three-dimensional shape. And I know that sounds ridiculous, but I've got a couple of ways for you to hopefully remember it a little bit easier and to really kind of conceptualize this a bit more, right? So there's three primary or cardinal planes that exist within the body. We're going to have the frontal plane, which is going to divide the body into front and back halves. We're going to have the sagittal plane, which is going to divide the body into right and left sides. And then we're going to have the transverse plane, which is going to divide the body into top and bottom. Okay? So we have frontal plane, which is going to be running through here. We have the sagittal plane, which is going to be running through here into side and side. And we have the transverse plane, which is going to be cutting us into top and bottom, if that makes sense. So here's what this is visualized as. So you're going to have a frontal plane, again, right here, or the coronal plane, because it's going through the crown of the head, and it's going to be cutting you into front and rear sides. So if you were to spin this person around, all you would see is their back being, like, you'd have them cut into front and back, if you will. The sagittal plane is going to mean that it is cutting us into side and side, and the transverse plane, again, is going to be cutting us into top and bottom, right? So it's kind of like this is a cross section, if you will. The transverse plane is essentially a cross section. Sagittal plane is side sections, and then the frontal plane is going to be a front and back section. Now, where this gets super goofy, and I'm going to mention it to you now, and we'll talk about it over the next couple slides. Movement within the frontal plane means that you're moving side to side because you're moving within this two-dimensional plane. So imagine if you drew an arrow going this direction and this direction. That would mean you're moving within the frontal plane. If you're moving within the sagittal plane, it means that you're moving within the plane of this direction. So imagine drawing arrows towards the back and towards the front. So that means you're actually moving in a forward and backward plane, right? So you're moving along parallel with this plane, not perpendicular with this plane. And then the same thing with the transverse plane. Imagine that you're drawing arrows here. You're drawing arrows along the plane. So you're actually, it's more of a rotation about this plane. So you're actually moving across this plane, not against this plane, if that makes sense. So some examples of frontal plane movement, right? Like here we're moving side to side. So you have abduction, so adduction and abduction of the hip joints. You have a lateral tilt of the pelvis, lateral flexion of the trunk. And then I think these are two of the best examples because I think they're easy to remember, and I think that they make more sense whenever you're doing them. And there are things that you can actually do in the gym and think, I'm moving in the frontal plane, right? And that's banded side steps or side steps in general. So anything lateral, like lateral bounding, is going to be a frontal plane movement because you're moving side to side, right? You're moving in line, in parallel with that frontal plane. Same thing with side laterals. It is a lateral raise. It is a sidewards movement, and you're moving within that plane. Sagittal plane movement, remember it's dividing us into right and left sides, but we're moving in parallel with the plane. So that means that we're actually going to be doing forward and backward motions, running, jogging, squatting, hip flexion extension, knee flexion extension, elbow flexion extension. Elbow flexion extension is a little bit goofy. But spinal flexion extension is another good example as well. So that's what each one of these pictures is really showing you, that it's moving in parallel with the line or with the plane. It's moving in parallel with the sagittal plane, right? Like you're following the directionality of the plane. You're not moving against the directionality of the plane. Transverse plane, again here, you're focused more on this rotation. So imagine that you're doing chest flies on a chest fly machine. You're doing trunk rotation. You're doing internal, external rotation or horizontal adduction, abduction of the shoulders. So you're actually moving in almost like a rounded pattern or in a rotation pattern in parallel with a top and bottom plane. Remember, what you need to know about planar movement, in frontal planar movement, sagittal planar, and transverse planar movement is that you're moving in the directionality of the plane. You're not moving against the plane. One of the best ways that I've ever come up with to remember planar movement is imagine a door frame. Imagine the options that you have when you get to a door frame. You can stroll through the door, which means that you're moving in the sagittal plane, right? You're walking straight through the door. You can lean on the door frame, which means you're moving in the frontal plane, if you will. Like you can put one arm against the plane, you can lean to the side, however. And then you can also try and close the door. And that door is then moving in the transverse plane. And your horizontal adduction, abduction is what's going to be moving the door in and out of the transverse plane, if that makes sense, or in the transverse plane. So that's one kind of quick way that you can try to remember you're moving through these doorways or you're moving through these planes. There are diagonal planes, and it's super important to think about that you can actually combine multiple movements in multiple planes. So one great example, and I think it's probably the hallmark example, would be a golf swing, right? Because not only are you moving in a transverse plane because you have a rotation, but you're also moving in what would be largely, essentially a sagittal and a frontal plane because you have twisting and you have movement within each plane. Whenever you're moving in these multi-directional planes or these diagonal planes, you're also going to have an axis of rotation. And you can see that axis of rotation is running perpendicular at a 90-degree angle to the plane of the motion. So that would be like the axis of rotation is a 90-degree angle in a straight line running directly through the plane of motion. When it comes to really trying to picture the axes, I think this helps quite a bit. So if you're moving in a frontal plane, essentially that sagittal plane is really going to be the axis of rotation, right? Because it's moving in a 90-degree, it's running 90 degrees or perfectly perpendicular to that plane. And if you're moving in the transverse plane, you're going to have a longitudinal axis that's running perpendicular to that plane. And if you're moving in the sagittal plane, you're going to have a frontal axis that's going to be essentially running 90 degrees to that plane. And you can see that here, right? So you've got the planes and you've got the axes. Those dotted lines are really representing the axes of rotation. Here's a good chart, and this is an example of like what a test question could be. I could ask you for a muscle or a muscle action or a movement and ask you to tell me what plane is the movement in, what is the motion, what's the joint action that's going on. Eventually we'll get there. And then what would be the axis of rotation that's going on. So one example would be, let's work with the squat. So we know that a squat is going to be moving in a sagittal plane. And if it's moving in the sagittal plane, then we know that the axis of rotation is going to be in the frontal plane or the coronal plane. It's the same thing. And you'd be able to tell me what the motion of the joint at, say, the knee and the hip would be. You'd be able to say, well, if you're on the descent, you're going through this type of movement. If you're on the concentric contraction, you're going through this joint action. And those are pretty good examples of what quiz questions and test questions could be like as we're moving forward throughout the semester.